welcome to Mental Health Matters. I'm Barbara Meyers. In today's show, we're going to focus on the most common mental health problem, anxiety. And we're very pleased and honored today to have two guests with us. First, Dr. Mason Turner, who is the Chief of Psychiatry at Kaiser Permanente in San Francisco. Welcome, Dr. Turner. And next, Janelle Hargrove, a person who has lived with anxiety on and off for several years. She's currently a trainee for peer counseling for an organization called Best Now, and she's also a facilitator of RAP programs at an organization here in Fremont called Reaching Across. So welcome, Janelle. And I'd also like to welcome Layla, who is Janelle's service dog, to the show. I'd like to start with talking with you, Dr. Turner, about just some basic information about what anxiety is as a mental disorder. Maybe you could tell us what forms it takes and how it feels and that kind of thing, symptoms.
Sure. Well, I think most of us are familiar with the concept and the feeling of anxiety. We get it in a lot of different situations in our lives, whether it's being anxious about appearing on a television program or some other things that actually can cause anxiety. We all experience it. Unfortunately, anxiety is like a thermostat. So the thermostat needs to be turned up sometimes, and you need to feel anxious about some things, but then you need to be able to turn the thermostat back down in order to not feel anxious all the time. Our bodies are not wired to feel anxiety all of the time. So what we find with anxiety disorders is that people are in a chronic state of feeling anxious and under a lot of stress. And that's really what we're looking for when we're diagnosing an anxiety disorder.
So they can't turn it down.
That's right. They can't turn the thermostat down when they need to do that.
Yeah. What are some of the forms that it takes that people are diagnosed with?
In my field of diagnosing and treating mental disorders, anxiety is, of course, the most prevalent, and it also takes the most forms when we see various patients with various forms of anxiety. On one end of the spectrum, we see people with what we would call situational anxiety. So they're in a particularly difficult time of their lives and they feel a lot of anxiety and they find ways to control that, or sometimes they don't and they seek some counseling with us to try to help figure that out. That's not technically an anxiety disorder. Anxiety disorders take on a life of their own, if you want to think of it that way. And they range from things like generalized anxiety disorder, which is a lot of worry. People sometimes refer to that as being a worrywart. Panic disorder, which is a physical form of anxiety. Very brief, intense periods of physical symptoms such as heart palpitations, shortness of breath, sweating, that type of thing. Mm-hmm. That can sometimes be very severe and actually interfere with functioning, that's for sure. Mm-hmm. Post-traumatic stress disorder is an anxiety disorder that occurs following a sustained period of trauma, and that can be trauma of any sort. Mm-hmm. You could actually be hit in a car accident and you could experience a post-traumatic stress disorder, mm-hmm. or also acute stress disorder is another way we think of that. Mm-hmm. Simple phobias, a fear of spiders, a fear of snakes, things of that sort also are anxiety disorders, and those are very specific to a given situation. Related to that would also be social phobia, so that's fear of situations that involve speaking in public or being around other people. Obsessive compulsive disorder, one of the rarer types of anxiety disorders, is also very debilitating for a lot of people, and that's probably one of the more difficult anxiety disorders to diagnose. Mm-hmm. That can also sometimes be associated with what's called hoarding, so holding on to items of mixed importance and not being able to get rid of those.
Could you tell us about what kinds of things you look for when you're diagnosing them and why it's difficult to diagnose?
It's very, very difficult to diagnose anxiety, although it's very easy to recognize it. And by that I mean that I know anxiety when I see it. So when someone's sitting in front of me and they appear anxious, I can recognize that easily. Mm-hmm. Most of us can recognize anxiety. Mm-hmm. The real problem is figuring out where the anxiety is coming from and how best to treat that anxiety. So first of all, I would want to look for, are there other mood disorders that we might be looking for? Things like depression, depressive disorders, bipolar disorder, manic depressive illness. Maybe the anxiety is related to that diagnosis and we really need to treat that particular diagnosis in a very specific way. When I'm diagnosing an anxiety disorder, really what I'm looking at is there a persistent pattern of anxiety far in excess of what we would expect to a situation? And then I do look for specific characteristics of that anxiety. So again, with a generalized anxiety, a persistent worry about things, a worry about worrying about things, and that type of thing. Panic disorder, again, those specific physical symptoms, and then so forth and so on as we kind of go through the anxiety disorders. sounds fairly simple and straightforward, except for the fact that anxiety disorders also blend together. So people have features of all the different types of anxiety disorders. And that doesn't even touch on if people are using substances to medicate anxiety disorders. We run into an even bigger problem because then the substances can be causing the anxiety.
Right, so it sounds like there's co-occurrence with substances, and there also is co-occurrence with other mental disorders as well.
Absolutely. And the substances become very difficult to sort out because some substances cause anxiety, others relieve anxiety, some cause anxiety in the withdrawal phase, so it's very difficult to sort that out.
I see. Well, what kind of treatments do you find most helpful? I imagine it would be different depending on which of these different types of anxiety that people have.
Yes, they're all very different depending on the type of anxiety disorder we're looking at. And when I think about treatments for anxiety disorders, I group them in terms of my own way of thinking about treatment into three categories. One is psychotherapy techniques, and that's primarily what I work with, actually, and what I usually recommend for treatment of anxiety disorders in the population of people that I treat. Medications are a second-line approach for anxiety treatment, but then equally important for all forms of anxiety are looking at other ways of managing that anxiety. Something as simple as engaging in some kind of stress management to be able to really unload some things from your plate, to working in more formalized techniques such as mindfulness-based meditation, peer supporting counseling, so I'll be interested to hear from Janelle what she has to say about that. And then also service animals, very important for a lot of people with anxiety disorders. When we think about the treatments of psychotherapy and medications, the psychotherapy piece is also quite complicated. For panic disorders, the primary treatment in psychotherapy is what's called interoceptive exposure. So what we do is we actually recreate the symptoms of the panic attacks. We have you spin around to emulate the sensation of dizziness, run around in place to emulate the sweatiness, things of that nature. And when you do that enough times, your anxiety lessens, believe it or not.
Oh, really?
Exposure therapies also are used for phobias. So if you're afraid of driving over the Bay Bridge, what we do is have you drive over the Bay Bridge, or initially maybe imagine doing so, and then your anxiety response would lessen over time. For generalized anxiety disorder, that's where medications really play a more central role. And so in addition to some of these psychotherapeutic techniques, we would add on typically antidepressant medications such as Prozac or Paxil or Effexor.
Sounds quite complex to try to figure out what's the best fit for all the various different types of things. Could you mention a little bit about agoraphobia and how that is treated, or what it is and how it's treated?
Agoraphobia is a fortunately pretty rare form of anxiety, but certainly it does affect a lot of people. And agoraphobia is basically, by the name, it means in Latin, I believe, it means a fear of the marketplace, fear of open spaces. And so people are actually afraid to leave their homes and be in places that don't have any containment or confinement. It can also be a fear of being in large crowds of people. So those two things will go hand in hand. And it's extraordinarily debilitating. If you can imagine that if you're afraid to leave your house because of panic attacks and agoraphobia, you're not going to be able to really function in society very well. And we treat that with a combination of methods. And usually something that severe, we'd be looking at several different methods combined. So we would certainly add on medications. Peer support with agoraphobia is very important because people who have been through the process and come through the treatment of it and are actually doing really well can help support and encourage the person to leave the house and help them to make some steps out.
Yeah.
And exposure would be the treatment of choice there.
Yeah, that's good. What do you think someone should do if either they or a loved one of theirs they believe is living with some sort of anxiety disorder?
The most important thing you can do is to recognize and realize that help is available for all the anxiety disorders. It sounds very daunting. Generalized anxiety, panic disorder, obsessive compulsive disorder, a lot of disorders.
Yeah.
But at the end of the day, there is help and treatment available for all of these different disorders. And I really can't emphasize enough that we really want to take a multi-systemic approach to treating anxiety disorders. And you want to really seek out a lot of resources in the community, seek out treatment resources. From my perspective as a physician, an evaluation is what's most critical to me. I want to find out what's causing the anxiety so that I figure out exactly what I need to recommend to the person at that point. So again, seeking help, getting an evaluation with a medical professional, but then really finding support groups and people that you can share your experiences with really helps.
Yeah, so you put a lot of different types of things into play, and then that makes them more effective than maybe each one of them separately might have done.
Exactly, and any of them will help. So if someone's afraid to seek out a consultation with a physician or a therapist, peer support and enlisting the support of friends is going to help. It's not that you have to do everything. Even if you do a small piece of that, it will definitely help.
I thought I would ask you some questions about how you became interested in treating mental health problems and anxiety disorders, and what kind of training and that kind of thing did you have?
Sure, yeah, I became interested in working as a psychiatrist and in mental health really as long as I can remember, from when I was a child. And one of the reasons why is because I personally think it's one of the most challenging fields in medicine. We have to have a command of medication management, diagnostic skills, things of that nature, but then also we really have to have an idea about how the brain works and also know that no two people are alike when it comes to these disorders. We have these beautifully neat categorizations of various things like these anxiety disorders, but yet no two people are going to present in the same way. So I can't just go to work and kind of go through a day without thinking. My brain always has to be active and really talking with someone about what's going on. There's also tremendous satisfaction in being with a patient, being with someone both when they're struggling and also when they're doing well. It's very gratifying to me to see when patients do well, but at the same time I also really enjoy hanging in the trenches with them when they're not doing so well and being there and being a constant source of support for them.
Oh, that's good.
And so that's how I became interested. My training involved several different aspects. So I am trained in medication management, but also had extensive psychotherapy training. And I also believe in my own training as a physician that it was important for me to experience all levels of patient care. I've worked as a nurse's aide helping patients with disabilities, do transfers and improve their self-care, to going into psychiatric group homes and doing some work there around just getting people more functional and getting them out in the environments, as well as being a physician and prescribing medications for patients.
What do you like most and least about your job? I guess you already said what you like most about your job.
Well, what I like most about my job is that every day that I go to work, I love every day that I've had. Occasionally, once in a while, there'll be a day that's a little too crowded or something along those lines, but I love going to work every day, and I think that's a tremendous gift, and it's because I get to work with people. I get to hear the stories of people, and they share those with me, and they trust me with that information, which is, for me, is tremendously gratifying, and I really enjoy working with patients. What do I like least about my job? Two things. I like least the stigma of mental illness, and I also like least the lack of resources we have for treating people with mental illness and mental disorders. And I've been very active in various organizations that really work to reduce the stigma and help to ensure that there are resources for patients. It's very, very troubling when people can't get the services they need.
Janelle, I'd like to talk with you now and have you tell us your story. When did you first come to know that you have a mental disorder?
Well, it was back in the end of 1999. I'd had my first child back in April that year, and she was about 5 months old at the time, and I started having anxiety and just feeling things I hadn't experienced before. I had some mornings where I'd wake up at 5 in the morning, my heart would be racing, and I couldn't breathe, and I felt really out of sorts. I knew something was, and it was gradual, but then it got worse every day. It progressed. So I was diagnosed the end of 1999. My husband, after I hadn't slept in 3 nights, and I was getting a little paranoid, and I was suffering from insomnia, and I was just getting where basic things could not function well. He said, "We need to take you to the hospital." And I went in and met with the nurse right away in emergency. We were living on the peninsula, and they said, "You're not going home. We're checking you in. You've got a serious anxiety problem." And due to lack of sleep, and then I was diagnosed with anxiety depression.
Anxiety and depression both.
Yeah.
Okay.
But then later it came out it was also postpartum. It was a combination.
So how has it affected your life since then? Or what kind of treatment did you go through, and how did it...
It's been quite a journey.
I know you've been through a lot, yes.
Well, that was the worst anxiety attack that I had. And it's so different from, say, the anxiety before you go do a presentation in front of a large audience. I mean, there's a very particular anxiety about that. This was something that was so out of control of my body, and I remember having feelings of just like I'm crawling out of my skin, and I don't know what to do, and it was just, the not being able to breathe, and paralyzing. It was just, I can just describe the anxiety too. It gets to such a heightened level. And that first one where I ended up being hospitalized for the first time, and luckily last time in my life, hopefully, that was an ongoing cycle that continued as years went by. And then I had different types of anxieties that followed, but that was due to different things.
Mm-hmm.
So,
what kind of doctors and treatments have you tried?
well, originally when I first went in and they checked me in, they gave me an anti-anxiety and a strong, just a mild antidepressant. It was an antidepressant and anti-anxiety, and I was okay for about 8 or 9 months, and then I was fine, and doctor took me off the medications, and I was okay for 6 months. Then they started again, the anxiety and more depression this time.
Oh.
Yeah.
I know your anxiety has been difficult to treat, and you've had a number of different physicians that you've tried to work through and so forth. Why do you think your particular case was difficult to treat?
Well, you know, I did know, I had gone through several doctors at one point. They kept treating me with antidepressants. And every time I take an antidepressant, within a short period of time, I started having anxiety. And then I remember one doctor, you got to stay on this. You're not on this long enough. Well, I'd been on it 2 weeks, and I was having, like, again, severe anxiety. I said, I can't continue. This is not working for me. And I remember if I took this one more day, I felt like I was just going to want to jump off a cliff. It was just horrifying. And, you know, it affects your family, and my daughter was still young, and, you know, it was just a vicious cycle.
Yeah.
And I remember one doctor that was treating me for a while kept putting me on antidepressant after antidepressant, and everyone, I had the same symptoms over and over. And she said, I don't know how to treat you. I can't work with you. She just, you know, and that was horrifying.
Yeah.
And that put me, you know, that caused even more anxiety.
Yeah.
So it was a long period until the end of 2006. A very well-recognized therapist recommended for me to see a specialist in Menlo Park, a doctor that specializes in bipolar disorder. And I saw him, and within 10 minutes of talking to him and filling out a couple pages of questions, he said, you've been misdiagnosed for 7 years. You have rapid cycling, which is bipolar. And it was such a relief after literally 7 years of up and down and, you know, going through a lot of struggles and battles.
Yeah, well, I'm glad that helped. What kind of things helped you the most? I know you do a lot of things for yourself other than just the medication that you're taking.
Yeah, it was a good kind of deep self journey with myself. It was, I got back into the Buddhism, which I had discovered in the mid-'80s living in San Francisco. I started chanting again, which helped a lot. It helped center me, calm me down. I started taking regular yoga classes. I also saw a homeopath that was just fabulous, that helped me a lot, and just a lot of things. Also discovering mindfulness was another thing that, and then getting Layla. We got Layla, this dog, a year ago, and she's just a natural anti-anxiety antidepressant. She's wonderful, and she's been great therapy.
Yeah.
So
I've experienced it in groups where Layla has been in, and she helps everybody in the group, I think, just by being there.
She's going to start being trained to be a therapy dog officially, so I can take her to hospitals too.
When you were in the hardest part of your illness, what is it that got you through? What is it that gave you hope?
Looking at my daughter's eyes, just knowing for her, and that somehow, you know, there were days when you don't think you can see the light at the end of the tunnel, but I couldn't live with the fact that, you know, it was her future. It was more about her. And even when I went through the postpartum, she was not at harm. I was at harm for myself. And, you know, with the combination of anxiety. But my husband, and knowing that, you know, part of what I went through is also a benefit in some ways, because my mother and I raised a very mentally ill sister, and I knew by then I had a mission somehow to continue in this field to help people.
Oh, good. So I know you're in training to be a peer counselor, and tell us what you see in your future.
Well, I've been continuing in my schooling, going to the Best Now program, which is a wonderful program, and hoping to continue more with that, and also with the Wellness Recovery Action Plan, and also doing my own therapy. and just a lot of things,
Yeah.
you know.
Do a lot of things to keep yourself healthy.
Yeah. Healthy things. And diet, too, is a big one, nutrition.
Mm-hmm. Yeah. So it's like you took a look at your whole self and what all the different parts of you and what you needed in many different levels and found ways to, get help. That's really good.
Yeah.
I'm happy for you.
But for people who've gone through it or have had anxiety, I mean, it's just horrifying.
Yeah.
And in the moment you're going through it, it's just, until you can come out of it, it's really scary. But knowing there is hope and friends out there helped a lot too when needed.
What would you tell somebody who is sort of in the depths of it now? What would you tell them to do?
What is it that works for you? I mean, I know I've learned some very good breathing exercises just to calm them down in the initial moment. Where can I take you? I know for me, I've had friends pick me up and just take me to a park and walk around. When my daughter was little, just go to a park and get out of the home, get out of the house. It's a big thing. The anxiety was at the worst when I was in my home. And, what is it you need? Whatever, reach out and hopefully something will remedy.
Thank you. Do any of you know of support groups for people with anxiety in particular that we might be able to recommend, or we might be able to know that they exist somewhere? I know that support group that I work here in Fremont, Reaching Across, there are people with anxiety that come there. And it's not specific to anxiety, but there are people that certainly have that as part of what they come across. So I know there are support. In Kaiser, are there support groups for people with that are going through problems with anxiety?
Yes, we have a number actually, and they're open to both Kaiser members as well as non-Kaiser members. And every Kaiser facility has some anxiety management program that includes usually support groups, some instruction groups in mindfulness-based meditation, and then also just some practical tips about how to manage anxiety that are just more of an informative nature, and that's really where the support group comes in handy. And every one of our facilities has those programs.
Yeah, that's great. What would the ideal future look like for you in terms of people who have anxiety disorders? So in terms of when would the intervention be? What kind of intervention would there be? Or what kind of services should we have available? What would the ideal future look like? Do you have any thoughts?
Sure can. I guess I can answer that one first.
Okay.
In terms of what I think the ideal future would look like, it's really about, again, that idea that there's so much stigma around anxiety and psychiatric illness in general that I think it's important if people can come in early when they first notice problems, before they're to the stage where they're in the hospital because maybe they don't know what's going on with their bodies. We actually work very actively trying to train people outside of mental health to recognize anxiety as well. So that if you show up at an OBGYN appointment, maybe they'll be able to pick up on that and say, I think you may have an anxiety disorder and maybe you need to talk to someone. So for me, it's really about trying to educate as many people as we can about the recognition of it in the medical field, but then also trying to think about how we address the stigma and increase more support and peer counseling in our communities.
Okay. Well, thank you. I'd like to now issue a challenge to those of you or in the viewing audience. Do you know someone who you believe is living with anxiety so severe that it interferes with their daily lives? Maybe it's someone you know, maybe it's you. And if so, I want you to think about what our guests have said and think how you can help this person understand how to recover from the illness. So that's your assignment. Now I'd like to move on to tell you about some resources and organizations that are available for anxiety disorders. First is an organization called Anxiety Disorders Association of America. The web address of that is on your screen. This is an organization that promotes the prevention and treatment and cure of anxiety disorders and to improve the lives of people who suffer from them. For specific anxiety disorders, there is an obsessive compulsive foundation which has information and resources on the web for people with obsessive compulsive disorder, their families and friends and professionals. Then another kind of anxiety disorder that Dr. Turner briefly mentioned was hoarding. It's a compulsive hoarding group that looks at people who are hoarders and their families. That includes research on hoarding and a screening test for people on hoarding, and the web address of that is on your screen. Then in general, there is an organization called NAMI, National Alliance on Mental Illness, that is sort of the premier mental health advocacy organization that has also information about anxiety as well as many other mental illnesses. And if any of you are interested in the Best Now program that Janelle is training with now, it's a program that trains peer specialists, learn how to work in human services positions. And the phone number and web address of that is on your screen. I'd like to thank Mason and Janelle and Layla for being our guests on the show today. And I have some closing words. Take courage, friends. The way is often hard. The path is never clear. And the stakes are very high. Take courage. For deep down, there is another truth. You are not alone. Thank you very much, and we'll see you next time.